So this is a question from AIIMS 2017 where they asked about the renal calculi management, and they mainly asked about the PCNL part. Okay. Now what happens is this table, this chart is pretty overwhelming, but there are many common things that you can just use in order to shorten the entire ureteric calculi as well as renal calculi management. So let's go ahead and see how you can shorten it. That was obviously taken from Marrow. So I've basically put the MCQ ID here, that is MB9221, and it's from AIIMS 2017 surgery question. So if you see the minimum thing, okay, whether it is renal or ureteric stone management, the minimum that you can do is a conservative management in case of less than 0.5 centimeters. So this stands true for both ureteric as well as renal stones. Okay, and the maximum in terms of common things that you can do is PCNL. That is, the indications of PCNL is what you have to remember. That is Staghorn calculi, Staghorn, that is renal calculi, more than 2 centimeters, and obviously Staghorn is a big calculi. If there will be multiple, then obviously it is going to be less than 2 centimeters. So that's why it's more than 1 centimeter. And one more thing you add here, that is proximal ureteral stones. So proximal ureteral stones, you can understand, more closer to the kidney. So that's why they are like, treated as that way. So these are just these two things, if you remember, okay, then you have a lot done. Okay, you don't have to remember all of this as well. Okay, if you remember these two things, a lot is done. Now what happens is you don't classify renal and ureteric, you just classify the size and then go according to renal and ureteric. So 0.6 is like a midway value. In case of renal stones, if it is more than 0.6 centimeter, you'll do ESWL and URS PCNL. Okay. If ESWL does not work out, then URS PCNL. And in case of ureteric stones, what happens is you have a range, that is 0.6 to 1.5 centimeter. There you just divide it into impacted and non-impacted. Okay. And then in case of impacted, you go to ureterolithotomy, and in this case you go for URS. Now what happens is, if you don't read it separately as renal and ureteric, you may take the size into consideration and then read it as renal and ureteric, so then it basically makes life easier. So the common things are this conservative, 0. less than 0.5 centimeter, PCNL, that is Staghorn calculi, more than 2 centimeter, and in case of multiple stones, and in case of the proximal ureteral stones it's used, and the last straw is always open and lap. Okay, so in between you just have to remember these things, and that's it. Then you don't even have to remember these two separately and then try and mug up everything. If you just pick up the common things, I guess you'll be good to go. So yeah, if you like this, give it a thumbs up. I know this wasn't a mnemonic, but there is actually no mnemonic for this. I mean, this is very difficult to make, and the only thing is you can think about multiples of numbers, which is very absurd. Just this, remember, it's like all one, two. So it's a bit sequential, but then it's not really something that you can put mnemonics to. But then you can always make it easier. So yeah, thank you and have a nice day.